Welcome, everyone. We're so happy you joined us today for the final talk in our spring series in the College of Health Colloquium series. This semester, we have been celebrating the founding and opening of the Institute for Health Policy and Politics with talks by experts in the area of policy. Next semester, look forward, we will be celebrating 50 years of women at Lehigh with a focus on women in health. So I'm going to turn over the introductions to Dr. Eduardo Gomez, who is the founder of the Institute for Health Policy and Politics and also the director. He's also an associate professor in the College of Health.
Thank you very much, Dean Dolan, and welcome everyone to our final colloquium series for this semester. I'm so happy that all of you can join us today. Today, we're honored to have with us as our final lecturer, Professor Carmen Ho, who is assistant professor in the Department of Political Science at the University of Guelph. And today she will be giving a lecture titled The Politics of Malnutrition. Why have governments been slow to act? Professor Ho is an assistant professor in the Department of Political Science and a faculty affiliate with the Guelph Institute of Development Studies and the One Health Institute. She is also a member of Harvard University's research cluster on comparative inequality and inclusion at the Weatherhead Center for International Affairs and an affiliate with the Hospital for Sick Children Center for Global Children's Health. Previously, she had a Fulbright at the Harvard School of Public Health with the Takami program in international health. She specializes in comparative politics and public policy with a focus on health politics and policy. She's especially interested in political conditions that facilitate the expansion of public policies with reduced health inequalities. Her work has been published in the American Political Science Review and has a forthcoming article in the Lancet series. She has also written for the Washington Post. Her research has been supported by grants and fellowships from the Social Sciences and Humanities Research Council of Canada, International Development Research Center, Canadian Federation of University Women, and Southeast Asian Research Group. So thank you, Professor Ho, and it's certainly an honor for you to join us today, and we look forward to your presentation.
Thanks very much for the kind introduction and the opportunity to share some of my research. So what I'm going to do is I'm going to start by sharing my screen. And hopefully you should be able to see my slides right now. So what I'm going to do in this presentation is I'm going to talk a little bit about malnutrition. And malnutrition technically refers to both overnutrition and undernutrition. But in today's presentation, I'm really just going to focus on undernutrition, which is the insufficient intake of energy and nutrients. And one of the biggest concerns today actually is the impact that COVID is having on maternal and child undernutrition, particularly in low and middle income countries. We've seen evidence that COVID has worsened rates of undernutrition in the global South. But, even before COVID, even before the pandemic, undernutrition was very much an issue. So this is a study that was in the Lancet, and it found that undernutrition contributed to an estimated 3.1 million child deaths in 2011. So this is about 45% of global child deaths. And this happened primarily in low and middle income countries. Now, for many people in global health, this was actually quite surprising. And this is because we have solid evidence on interventions that could address undernutrition. And these nutrition interventions are simple, they're relatively low cost. And so what we would expect is that governments would recognize that, we have this serious issue that affects a lot of people. And because solutions are readily available, we would expect that governments would act to expand the needed policies. And yet, what a WHO report found was that despite the availability of these nutrition interventions, national nutrition policies do not adequately respond to the challenges that countries are facing. So there are two questions that I want to try to tackle in this presentation today. And the first question is, if we have this issue, if we know that undernutrition affects a lot of people, and if simple, low-cost interventions exist, then why have governments been slow to tackle undernutrition? And the second question is, well, if we have an understanding of why governments have been slow to tackle undernutrition, then, what facilitates government action? What can catalyze governments to act and expand the recommended nutrition policies? I'm going to start our conversation by telling you about some of the nutrition policies that have been recommended. And these are recommendations that were made based on research that was done by health scholars such as yourself, research that was done by nutritionists, doctors, epidemiologists, health economists. And what I'm going to do is I'm going to point to two broad characteristics of these nutrition policies. And maybe as I'm talking, you'll be able to identify the two characteristics that I'm going to be pointing to. So what I'm going to put up on my screen is a list of recommended nutrition policies. So take a look at these and maybe you'll start to see some of the characteristics I'm going to be talking about. But on the left, what you'll see is the UN Scaling Up Nutrition Movement's recommendations. Now, the Scaling Up Nutrition Movement is also called SUN for short. And what this is it's a UN-led initiative that draws attention to the really high levels of undernutrition that exist. And what SUN does is it organizes global meetings to bring together important stakeholders. They come together and hopefully discuss, what can be done to tackle high levels of undernutrition. This UN initiative also disseminates policy recommendations, including the recommendations that you see here, and it monitors governments on their compliance with these policy recommendations. So in these recommended nutrition policies, what you'll see is interventions like promoting good nutrition practices, like breastfeeding, complementary feeding for infants. You'll also see things like increasing the intake of vitamins and minerals, like vitamin A, zinc, and iodine. And you'll also see providing therapeutic feeding for malnourished children. I want to show you another set of policy recommendations. These are from the Global Nutrition Report. And what the report recommends is nutrition interventions that start from preconception, they run through pregnancy, through breastfeeding. And these interventions also focus on things like folic acid supplementation, calcium supplementation, multiple micronutrient supplementation, and things like salt iodization, which increases population intake of iodine. So what I had said before was I was going to point out two broad characteristics of these recommended nutrition policies. And maybe by just me talking about this a little bit, maybe you've picked up on them. But the first thing you should have noticed is that these recommended policies primarily target women and children. And it's not just women and children broadly, it's actually low-income women and children. This comes out a little bit more in the written reports because disaggregated numbers show that the prevalence of stunting, which is low height for age, which is a common measure of chronic undernutrition, but the prevalence of stunting tends to be higher for children in the bottom economic quintile. So the first thing you may have noticed is that policies primarily serve women and children. And this is actually low income women and children. Now, the second thing that you may have noticed in the policies that I showed, the policies that were recommended by SUN and by the Global Nutrition Report, is that the recommended nutrition policies focus on micronutrients. Now, not all focus on micronutrients, but most are trying to improve the intake of essential vitamins and minerals like iodine, iron, vitamin A, zinc, and so on. So I want you to remember these two things. that the recommended policies would serve poor women and children, and they would address micronutrient malnutrition, because these characteristics are actually really important for understanding government inaction. I'll be coming back to this in a little bit, so I just want you to kind of keep this in the back of your mind for now. So let me just return back to the first research question. And this research question is, why have governments been slow to tackle undernutrition? And one of the assumptions that's often made in the health literature is that government action is based on evidence. What I mean by this is that there's an assumption that if governments are provided with evidence about, say, the prevalence of an issue or the availability of solutions, then governments will act. Now, no one says this explicitly. You won't see it formally written down anywhere, but it's implicitly woven into a lot of explanations about government action and government inaction. And this shows up in the ways in which the health literature talks about undernutrition and the prospects for policy change. So let me give you an example of this. What you'll see is this assumption in the Lancet's paper on undernutrition, that evidence is what triggers government action. And what the authors say is that the availability of timely and credible data presented in accessible ways can help governments to be responsive. And the effective marshaling of evidence can create momentum for policy expansion. So the assumption is that policy expansion is a product of producing and disseminating data on the prevalence of undernutrition and, the relevant policy solutions. Now, you also see this assumption in the Global Nutrition Report. So, for example, the 2017 report says policymakers and the entities which support development make evidence-based decisions to drive country development and improve human outcomes. Now, evidence is absolutely important, and it should rightfully inform government decisions. But we cannot assume that evidence alone is what triggers government action. And the political science literature has repeatedly pointed out that policy reforms do not occur simply because evidence accumulates about the severity of a problem or even about the positive benefits of change for welfare. And what this means is that the accumulation of knowledge and evidence does not automatically lead to government action and policy change. And if we step back and we think about our own experience with our own governments, we know that the primary driver behind government policies is not always evidence. We can think about, say, government responses to climate change, for example, where we see evidence really mounting about the impact of climate change. And, certain governments have been either slow to act or we've just seen outright denial. So our own governments do things that suggest that, its policies are not purely motivated by evidence. So one of the things that what I really want to hit home in this presentation is that we can't think of governments as, these neutral organizations that consider evidence, that weigh the pros and cons, and then they act to introduce policies. We can't assume that governments are apolitical. Governments have their own goals, their own objectives, and they're staffed with people who have their own goals and their own objectives. And sometimes, these align with what scientific evidence will tell us, but sometimes these goals and objectives don't. So what health scholars and practitioners could do a little bit better, I think, is understand a government's motivations. And if we revise our fundamental assumptions about governments, then we can begin to understand why government action on undernutrition has been slow. So let's talk a little bit about a government's motivations. And a term that, really makes the rounds in the health literature is political will. Maybe you've heard it used before. There are questions like, when does a government have the political will to address neglected diseases? And this comes up in the global health literature a lot. Or when do governments have the political will to address issues like undernutrition, for example? But this is really where the discussion stops. A lot of the literature will acknowledge that political will is a thing, that it's important, but there isn't as much of a discussion about why governments may or may not have the political will to take action. So I want to talk about this. And one way to understand a government's motivations is to think about governments as organizations that are primarily concerned with political survival. And all this means is that a government wants to continue to exist. So if a government angers powerful groups in society, or if a government can't garner support from its citizens, then there's a very good chance that the government may cease to exist. So the political party may get voted out, the leader may be overthrown. And this concern with political survival affects the policies that governments choose to prioritize. Now, this is really important. So I'm going to say it again. This concern with political survival affects what policies the government chooses to prioritize. So what I'm going to do is I'm going to tell you about some of the classic arguments in the political science literature, which start with this assumption that governments are concerned with political survival. And what I want you to do is I want you to think about these arguments as they relate to the nutrition policies that we talked about earlier. Remember, the recommended nutrition policies suggest or recommend that nutrition policies serve low-income women and children and address micronutrient malnutrition. Okay, so one of the classic arguments in the political science literature is that governments are more likely to prioritize the needs of groups whose support is crucial to political survival. And a group that can influence a government's political survival is economic elites. So economic elites are high-income folks, or the rich. They have the material or resources to influence the government's survival by, say, donating to the political party that's in power, or they could donate to the opposition party. And so what economic elites are doing is they're using their money and their resources to, influence the government. They can also use their money and resources to lobby the government and influence policy in this way. But really what the research is showing is that there are a lot of ways in which economic elites can influence government policies. So what we end up seeing is a lot of policies that favor the wealthy. Now, this isn't to say, though, that government policies only serve the rich, because there's another classic argument in the political science literature, and it really focuses on labor organizations like unions. And there's this idea that, the working poor can exercise pressure on the government by organizing and by mobilizing. So let's use the example of blue-collar workers. Individually, blue-collar workers don't have a lot of power to influence change. Individually, they don't have, the same economic resources as high-income groups, and they may not have, the same political connections to threaten a government's political survival. But as part of a bigger group, individuals organized as, say, a labor union are better positioned to act collectively to influence the government. So, for example, a union could use strikes and protests to exert pressure on a government to try to influence its policies in a way that's, favorable to them. So let's think about some of these theories in the context of nutrition policies. Now, the experts recommend that nutrition policies focus on poor women and children. And first of all, low-income women and children don't have the financial resources and connections to influence government policy in the same way that high-income groups can. But another thing that we know about poor women and children in low and middle-income countries is that they often work in the informal sector. They often work in jobs as domestic helpers, street vendors, small-scale farmers. And what this means is that they're not typically all working for one employer. So there are fewer opportunities for them to organize as a labor union. And what this then does is it reduces their opportunities to use strikes and protests to demand governments expand policies to meet their needs. So if a government's primary concern is political survival, it's going to prioritize the needs of groups like the wealthy or mobilized unions. And poor women and children aren't going to be high on the government's priority list. So this can start to help us understand why so many governments have been slow to take on undernutrition. Now, if you remember in the earlier discussion of nutrition policies, the second characteristic of the recommended policies is that they address micronutrient malnutrition. So let me talk a little bit about this. There's another body of political science research that shows that governments expand policies for political gain. So governments want to claim credit for expanding the needed policies because this is a way in which they can stay in power. So, for example, in democratic countries, politicians want you to know all of the great policies they've introduced. So you'll remember this the next time there's an election and you're at the poll. There's another body of research that's somewhat related to this, and it shows that governments expand policies in response to crises. So crises are like very highly visible things that people are concerned about. They're all talking about this, like an infectious disease outbreak, or there's a shortage of food. There is a crisis, and the government wants to be seen as doing something about this particular problem, especially if everybody's talking about it. So being seen as taking action increases the government's legitimacy. But what about issues like micronutrient malnutrition, where people aren't really aware of the issue? Well, micronutrient malnutrition is an issue with low visibility. Citizens don't often know about the issue. And most people don't know, for example, that an iodine deficiency is the leading preventable cause of brain damage, for example. And most people don't know that iodine is added to their salt, that the salt they buy in grocery stores is iodized salt for public health reasons. Most people don't know that governments can mandate salt iodization to increase population intake of iodine. And similarly, most people don't know about their vitamin A or zinc status. So politicians aren't going to win elections by addressing micronutrient deficiencies. This isn't what wins votes. And so the low visibility of micronutrient malnutrition then has two pretty serious implications. One, the average person is not aware of the issue, so the government can't use relevant policies to garner political support. And two, people are not likely to mobilize to demand that governments expand its policies to meet their needs around micronutrient malnutrition. So if we go back to this original question, why have governments been slow to tackle undernutrition? Well, it's because governments don't always have strong political incentives to prioritize these policies. Poor women and children don't threaten a government's political survival. And, we don't see people mobilizing to demand better nutrition policies because micronutrient malnutrition isn't top of mind for most people. And governments can't easily use nutrition policies to win elections or garner political support. So what we see then is that governments end up prioritizing other policies, and this then pushes nutrition policies off the national agenda. And so governments have been slow to tackle undernutrition. So this then leads to the second question that I presented earlier. So what then actually facilitates government action? Well, I've been interested in the conditions under which governments expand nutrition policies. And I've done a bit of research on this in low and middle income countries in Southeast Asia. And what I've done is I collected 3 types of data in Southeast Asia when I did field work pre-pandemic. The first type of data I collected was informal participant observations. So I spent 3 months with the nutrition section of a UN agency. The second thing I did was I carried out 71 in-depth semi-structured interviews with actors involved in nutrition policies and programs. And I talked to folks in Cambodia, Indonesia, Laos, the Philippines, and Thailand. And the third thing I did was I collected information from a variety of secondary sources. And in this presentation, what I'm going to do is I'm going to focus on the Indonesia case. And this case is particularly interesting because for decades, the Indonesian government really just ignored the problem of undernutrition, even though it affected more than a third of children under the age of 5. But then suddenly, out of the blue in 2012, it expanded its nutrition policies. And what it did was it introduced a raft of new nutrition policies, and it redirected funds towards addressing undernutrition. So what explains this? Well, what I argue is that bureaucrats were behind policy expansion. And this might sound painfully obvious that the people who write the policy are responsible for policy expansion, but bear with me as I try to explain this. When we think of government, we often think of it as this organization that speaks with one voice. We often approach government as kind of a monolith. But the reality is that governments are organizations that are made up of many different government units. These government units can be various government ministries or decision-making bodies. Sometimes sometimes the government units have agendas that align, but sometimes their agendas don't align. And some units have more political power than others. And this matters for, which issue eventually gets prioritized or which government unit is best able to advance its particular issue on the national agenda. The other thing to remember is that within these government units, there are different bureaucrats. And sometimes bureaucrats get along and they work together well, but other times they don't. So introducing new policies is not simple and it's not straightforward. It's not like you have a bureaucrat who works in the government, they become convinced that nutrition policies are needed, and then poof, we see new policy. This is not how it works. It's actually much more complicated than this. Even if a bureaucrat wanted to champion a particular policy reform, it's difficult to get the needed government units and the people within these units to cooperate. And this is especially true for certain health policies like nutrition policies, which require coordination and cooperation between different government ministries, like the Ministry of Health, Welfare, like Agriculture, Education, and so forth. So a government bureaucrat might believe that new nutrition policies are needed, but they might struggle to get this prioritized on the national agenda. So what an Indonesian bureaucrat had told me was that, if someone suffers from anemia, we can't see it, right? So we're struggling to convince everyone that nutrition is very important. So what this bureaucrat was speaking to was the idea that micronutrient malnutrition has low visibility. It's actually often called hidden hunger because people don't know about it. They don't know if they're affected by it. So when they say that if someone suffers from anemia, we can't see it, they're talking about hidden hunger in this particular way. And it's really difficult to convince everyone that, what's needed is better nutrition policies that provide iron, for example. Now, an individual who has experience working for an international non-governmental organization and a UN agency, had told me that actually governments are more likely to respond to visible emergencies like a drought or a cholera outbreak rather than an invisible emergency like micronutrient malnutrition. And what they told me was, I think, like all things, people are busy and people prioritize what is being presented to them. And there's a tendency to work towards the emergency aspects. So what this tells us is that it's difficult to push through recommended policy changes for tackling undernutrition. But in the case of Indonesia, what we had were bureaucrats who saw that nutrition policies were needed. And they had tried to elicit policy change in the past, but they were part of the Ministry of Health, which is a government unit that tends to be politically weak and doesn't hold a lot of sway over the national agenda. So what these bureaucrats did was they deliberately sought to augment their political power within the government bureaucracy. And I told you earlier about the UN SUN movement, the UN Scaling Up Nutrition movement. And this was a UN initiative that emerged around 2010. And what it was doing was drawing attention, international attention, to the prevalence and the severity of undernutrition. And Indonesian bureaucrats saw this as an opportunity to build their political power within the government bureaucracy. And they used it to bring together like-minded individuals within the government and create what I call a coalition within the government. And this coalition then strategized different ways that they could then elicit policy reform. And what they did was they used the SUN movement to get the issue of undernutrition onto the president's agenda. They were persistent, they pushed for the country to make a commitment to the UN SUN movement. And once the president agreed and Indonesia officially became a SUN country, they then used this to create a sense of urgency within the government to introduce new policy. And they used the country's commitment to SUN more of as an excuse almost to call meetings around nutrition, to pressure different government ministries to work together, to cooperate. And all of this kind of coordination was what was needed for the introduction of expanded nutrition policies, this urgency and this cooperation and coordination. And what we see is that as a result of bureaucrats' efforts, their planning, their strategizing, their use of the SUN movement to cajole others into action, what we then see subsequently was the policy reform that happened starting in 2012. So what I'm trying to make clear is that within the government, these bureaucrats were deliberately strategizing ways to introduce new policies. And what they did was they leveraged international attention to create pressure within the government for policy change. And it was these strategies that led to the introduction of a host of new policies. So in Indonesia, there was the introduction of a policy framework in 2012. And this was accompanied by new implementation guidelines in 2012 as well, and then a presidential decree to accelerate improvements in nutrition in 2013. So let me just return to the two research questions that I posed at the beginning of the presentation. And let me just kind of wrap up by answering both of these questions. So this first question was, why have governments been slow to tackle maternal and child undernutrition? And what I'm trying to show is that, we have all of this evidence that, underscores how serious the issue of undernutrition is and how prevalent it is. And a lot of evidence has accumulated on the need for urgent action. But we also have to consider the politics of policy reform. And in the case of the recommended nutrition policies, governments don't actually have strong incentives to take action. They don't have strong incentives to expand nutrition policies. Now, this doesn't mean that, we should abandon these policies. It doesn't mean that we can't rely on evidence, to formulate policies. But what it does mean is that we can't rely on evidence alone to facilitate policy change. So in the case of nutrition policies, governments don't have strong incentives to serve low-income women and children, and there's no significant electoral gain for expanding nutrition policies because of the low visibility of the issue. So there are some serious political factors that are working against the expansion of nutrition policies. And so what I'm trying to argue is that we need to think about these particular political factors, because then it helps us understand or helps us think about other strategies for facilitating or advocating for policy change. So this leads me to the second research question that I posed, and that was, well, what facilitates government action? And what I use the Indonesia case to show is that bureaucrats can play a very big role. And they use the international attention that the UN Sun Initiative had created to really draw attention to the need for Indonesia's government to act. But what they did was they used international attention to augment their political power within the government. And they used this to create a sense of urgency, facilitate cooperation and coordination, and this subsequently led to policy change. So for those of us who are thinking, about the drivers of health policies, those of us who are thinking about, what facilitates policy reform, we need to consider the ways in which politics can also shape policies. And we can think about, economic elites, as I'd mentioned earlier. We can think about labor unions. We can think about vote-seeking politicians and the role they play in policy expansion. Or another factor to consider is the role of bureaucrats in catalyzing government action and the strategies that bureaucrats can use to facilitate policy change. So thanks very much for the opportunity to share some of my research. If anyone is interested in reading more about the Indonesia part of my presentation, I've just published an article that I had mentioned earlier in the American Political Science Review. It's called Benevolent Policies. And the latest issue just came out earlier this week. So you'll find my article in this issue. So thanks very much for listening.